So welcome. So today's topic for our wellness chat is fall prevention. I'm sure this is a topic many of us are interested in because no one wants to end up falling. Obviously, there's many chance of injury, and it's probably one of the number one things that we need to prevent as we get older. So we're going to be talking about fall prevention, all the different methods, what a fall is, and related issues. And at the end, we'll have a little time for discussion if you have any questions. So really quick, did you know 1 in 5 falls results in serious injury? So hence why we definitely don't want to fall. 25% of hospital admissions are from falls. And an estimated cost of falling is $50 billion annually. So it has a huge effect on the healthcare system, and it's something that if we just start implementing a little more fall prevention methods and awareness, it can, really have a powerful effect on the healthcare industry and preventing hospitalizations. So first, what is a fall? Falling is anytime you land on the ground or some lower surface when you didn't intend to be there. So it's unintentional. This includes slipping, tripping. It could also be, you get up and then, you kind of lose your balance. You have to sit back down. It does not include medical events or accidents. So, if somebody pushes you and you fall, that's technically not in what we're talking about. We're talking about more about falling due to, the environment, you didn't see something and you trip over it, something typically that you're involved with personally. And the main thing is that the intention, you end up on the ground when you didn't mean to. Now, when most everyone has a fall at some point in their life. I mean, I've fallen actually personally running on trails, and of course I didn't intend to. And next thing I know, there's a rock and I fall. And what can happen after having a fall is you develop a fear of falling. And fear of falling is the lasting concern about falling that may cause a person to stop doing activities he or she remains able to do. So fortunately for me, I still run despite having had a few falls. But if it happened frequently enough, I may choose another sport or activity because I start getting a little bit afraid. And so anytime we have a fall, especially if it's a serious one, a fear of falling often increases. And when you have a strong fear of falling, that actually can increase your future risk of falling. Fear of falling can stop you from doing activities. And this in turn can weaken your legs from inactivity. It can make a person feel alone because maybe you're not going out as much, which in turn can cause depression. And all this can lead to a greater risk of falling. If you tend to isolate more and become less active, you become weaker, posture gets worse, and you end up becoming even more at risk. So fear of falling is something that's just as important in preventing as is falling itself. So some of the risk factors for falling, most falls result from a number of factors, and these can be physical, behavioral, or environmental. Physical risk factors are changes in your body that increase your risk for a fall. So this could be posture, for instance, a strong kyphosis. If you're hunched over a lot or looking down, that actually can increase your risk of falling. Muscle strength, if you're fairly weak in the legs, that can increase. So anything that physically is going on with you, chronic conditions as well, like arthritis can be an example. Behavioral risk factors are things that we do or don't do that increase our fall risk. So this is more to do with maybe our decisions and choices. If it's, snowy out or icy out and you decide to go on a walk, may not be the best choice because it increases your chance of falling. Or if you decide to climb a tall step ladder, that can increase your risk of falling. So making what the choices that we make and behaviors, things that we do can increase our risk of falling. And finally, environmental risk factors, hazards in our home and our community. So especially our home and places that we're at, we want to make sure that they're fairly fall proof. So being mindful of things like, loose carpets and, having, if a chair is really low, that actually can be a hazard. So how we look at the environment and definitely plays a role. If there's clutter on the ground, that can increase your risk of falling. So just a little overview of some fall risk factors. There are many fall risk factors that you can change. So physical inactivity, you can change that by going outside regularly or getting some exercise, get an exercise routine. That's something you can definitely change. Your home environment, keeping things tidy, talking maybe to someone, an OT or somebody about, installing bars or things that make your home safer and more, fall preventative. Your vision, getting a regular vision test, making sure your prescription is correct. Medication use, being aware of your medications, if they have any effects that might affect your fall. Fear of falling. That's something that more can change as you develop confidence in yourself. So, I would say something like fear of falling, with exercise can improve as you gain confidence and as you're falling less. Social isolation. So, if you're stuck inside, getting out, reaching out to your family is one way to change that. Your weakness, of course, exercise also can affect muscle strength and such. And assistive device use. Maybe walking is getting a little more harder and you need an assistive device, maybe a walker or a cane or something. When you start to notice changes, it might be good to consult a doctor about using an assistive device to help minimize falling. Now, there are some things, obviously, you can't change: your age, gender, ethnic background. And each of these have some level of effect on falling. Age in particular, certain factors like muscle atrophy and arthritis can affect, and posture can affect your ability, your chance of falling. So that's why it's good to work on the things that you can change as we get older. So what can you do to prevent falls? These are kind of the four main things. Number one, exercise, focused on balance and strength. And it takes, there's a study that shows it takes about 50 hours every 6 months to improve your balance. About 50 hours of really balance and strength focused type exercise. So kind of keep that in mind. In general, you want to, it's good to do a class like this at least twice a week. That's really focused on fall prevention, on balance and strengthening. Have your doctor or pharmacist review your medications. So be mindful of what kind of medications, what the side effects of medications are, and if there are any implications on affecting your balance. Have your vision checked, and have it checked annually. Is really important because our vision plays a key role in keeping our balance and thus preventing falls. And finally, make your home safer. So having your home evaluated by an OT, making sure things are tidy and such, maybe modifying as needed to keep it safe, with bars and handholds and such. In regards to exercise, you always want to talk to a doctor before starting an exercise program. So get doctor's clearance. It's good, especially if you're focusing on fall prevention, to maybe talk with a physical therapist or get enrolled in some fall prevention specific classes, also balance classes. And be sure classes are for your age group and or ability level. And then, of course, stick with it. So exercise consistency is always number one to really have an effect. For the environment, you want to identify and eliminate all fall hazards in your home and community. And as I kind of mentioned, an occupational therapist or physical therapist could help you identify these issues and give solutions. There's many factors, sometimes things that the average person may not notice. Keeping a place clean is very important, but sometimes maybe the toilet is too low, or some of the chairs that you sit in, like a recliner, is too low and it's hard to get out of. That can raise your risk of falling. So it's good to talk to a professional, maybe, if you think that there might be, if you've never talked to somebody in regards to your home. For medications, again, being mindful of the side effects. Some of the side effects of medication are making you dizzy, and thus can give you increased risk of falling. It's good to have an annual medication review, either with your doctor or pharmacist, and be able to, make sure you can read the labels for your medication. And then vision and fall risk, as we talked about, vision plays a really key role in maintaining your balance. So after the age of 50, you should have an annual eye exam, because eyes do change as we get older. Multifocal lenses can actually blur or distort your vision when looking down. So it's better to have separate reading glasses. And then if you have, cataracts, consider, cataract surgery, consider having those removed if a doctor advises so, because that can really improve vision. Other factor is blood pressure and fall risk. So make sure that you know what your general blood pressure is. Having that checked regularly is important. And if you get dizzy when you stand up, see a doctor, and they can do a sit and stand test and check your blood pressure. Sometimes, we get lightheaded or faint when we stand up quickly, and that could be a sign of, something with your blood pressure, which, of course, can raise your risk of falling. Of course, be mindful that some blood pressure medications can increase your fall risk. So again, just being mindful of that when taking medication. Also, being mindful that a lot of chronic conditions do increase your fall risk. I mean, virtually any chronic condition. So if it's a pain condition, that can affect your posture and how you walk, which can increase your risk of falling. So something like arthritis, you may, if you have a bad right knee or something, that will alter your walking pattern, and therefore increase your risk of falling. So addressing that is important. Diabetes, that can actually cause damage to, like, neuropathy in your feet, which can, weaken that sensitivity and make you more at risk of falling. Conditions like stroke, can affect one side of the body, making you more at risk. Of course, neurological conditions like MS and Parkinson's also, affect your balance and your gait. And sleep disorders, of course, if you're sleepy, sleep deprived, then you're gonna be a lot higher risk of falling, because you're just not completely there. So just be mindful that most chronic conditions are going to have some effect on your chance of falling. So keep that in mind and find ways to address those conditions. Kind of an overview, your risk of falling may increase with a change in medications. So if anytime you get a new medication or any kind of change in dosage, just keep in mind, will this affect your balance or, your chance of falling? Any new illness or infection, of course, can do that. Any new pain, lack of sleep, if you're sad or worried, that can affect your chance of falling. Reduced activity level, a change in use of a cane or walker. So any change in an assistive device, for instance. And if you move to a new area, or if you're going to any new environment, there's always a increased risk of falling. So just be very mindful of that. Anytime you go to a new place, approach cautiously. So a little more into preventing falls specifically, some of the methods. Probably one of the first things you want to do is consult your doctor and other health professionals. So doctor really first can help you review your medications, and side effects that can cause you to fall. A pharmacist can also probably help with that review. An occupational therapist is a good professional to talk about a home assessment and recommendations on how to make your home safer. And then a physical therapist is a good starting point for assessing your balance and helping you develop a physical activity program and ways of moving safely and preventing falls. So those are kind of the professionals you might want to think about if fall prevention is really important, something you want to improve. The next thing that's really important is start exercising and include strength training. So regular exercise is really essential for fall prevention, and strength training specifically is strongly correlated with improved balance. So having stronger lower body strength, doing things like sit to stand that this guy is doing on the side, anything that improves your lower body strength is going to have a powerful effect on preventing falls. Exercise can also improve your posture, of course, improve your muscle strength, improve your joint range of motion. It can help you maintain efficient movement patterns and assist with management of chronic conditions. So a lot of those chronic conditions we mentioned earlier, almost all of them are positively affected by, regular exercise routine. So exercise is really, really key for fall prevention. And to take it a step further, when you're choosing, when you're doing exercise, I would say at least twice a week, it's good to choose an evidence-based fall prevention program. So we have a balance class here at the Terraces, in which we lead various balance exercises that are evidence-based, actually based out of the Fall Proof program at Cal State Fullerton, which is a recognized national program. Tai Chi is another really good fall prevention type exercise, as it's really beneficial for your balance and posture. And there are other programs out there too, often led by other like healthcare professionals. Some of the names are like Otago Exercise Program, Matter of Balance, and Stepping On, just to name a few. So there's a lot of programs out there, but it is good to join some of these classes to get a little more understanding of how to improve your balance and to directly address fall prevention. So in summary, if we haven't said this enough, to prevent falls, number one, you want to always talk to your doctor, see what they recommend. Have your eyes checked annually. Check your medications for any side effects that increase your risk of falling. Exercise regularly, focused on strength and balance, and reduce clutter and tripping hazards, especially in your home. So that is our just overview on fall prevention. Any questions or